The expectations are high. I hope there's not resentment afterward for how this goes. But thank you for having me. I want to, Andrew, thank you for your words. And, I talked to Brad uh, in the last few weeks as we were kind of putting this thing together and talking about it. And I just want to thank your family for what you all have done and what you all have put in place with this. I haven't spent a lot of time with you, but I've seen you at these events over the last couple of years, and it's obvious where your hearts are. And I think, appreciate you more than we could ever say. And a bit about Chris. I met Chris a couple of years ago. He reached out, and I, he's one of the warmest guys I know. He's generous. He's caring. He came to North Texas, and we had lunch one day, and his question to me was, "How can I help you?" Right? I'm a young researcher. You can not that young, but in how long I've been working in this field, and he said, "I want to help you grow in your Parkinson's research." We had a very common vision, helping people holistically. How do we help someone live better today than they did yesterday? And that's what we focus on. And so that's really what I'm going to talk about today. My goal is that you walk out of here with one thing that you can say, I can implement this in my life on my way home tomorrow and see if it doesn't make your life a little bit better. So let's get started. So the focus with Parkinson's disease forever has been motor symptoms, right? How do we treat the motor symptoms associated with this disease? Critically important, right? I understand that it's been called a motor disease for so long. I think we're getting to a place where the community is beginning to recognize this as a holistic disease and not just a disease of movement. Very rarely do I keep moving, this thing's squeaking, I better stand still. Very rarely do I have a conversation with someone who has Parkinson's and they say, my biggest concern is my tremor. Usually it's things like depression, anxiety, apathy, my lack of participation, my connection with other people. Those are the things that are affecting my quality of life. And so when I got into this field, just as an aside, I worked in the pharmaceutical industry for 20 years before my mom was diagnosed, and she was diagnosed nearly 15 years ago. And I quit my job and said, I'm going to go back to school and figure out a way I can help her. And was too old for medical school at the time. So I thought, let's just get a PhD and see how that works. And so that's what led me to this field, is saying, I want to see her live better than she has been. And how do we do that? And so that's what the goal is today, to talk about how can we help people live their best life? How can we help them find purpose? We're going to talk about meaning and purpose, which is a critical element in quality of life for all of us. And so if you don't have Parkinson's, this applies to you. I have some slides that talk specifically to care partners, right? All of these things apply to me as much as they do you. So take it for what it's worth. Let's see how this goes. So as we think about treating holistically, I was fortunate to be involved in this publication last year, Holistic Wellness in Movement Disorders Clinical Practice, where it was done by the Movement Disorder Society. There were about 30 authors on this paper. And we went through and we looked at what are the areas that we need to look at to help someone live a better life. And so this picture that was in this publication, I think addresses each of those areas. I'm not going to talk about every one of these. Some of them I'm going to hit on. But I think that because of this article, we're seeing the names in movement disorders and in Parkinson's in particular beginning to recognize the importance of holistic care. You've got Bas Blom and you've got Ray Dorsey and Mike Oken, who are all beginning to talk about this stuff more regularly, and we're seeing the publications. And some of them I'm going to talk about their work in just a second. But we're going to talk about some of these leaves on this flower as we go, and hopefully it makes sense to you. So I just mentioned Bas Blom. So one of the things that we talk about, lifestyle management, and does it really matter, right? Does it matter if I'm doing these things, if my diet is good, if I'm exercising, if I'm connecting? Do those things really make a difference? And Bas published this paper with his group late last year. And if we look at your left side of that graph, We look at, motor symptoms and non-motor symptoms tend to get worse when we have suboptimal lifestyle, way that we're living our lives, right? It leads to poor compliance because maybe we have this anxiety, this apathy, we're not feeling good about life, so we don't want to engage, and we may not follow the recommendations of our doctor, one of which everyone in the room understands is exercise, right? Problem if I have apathy and you want me to exercise, I'm probably not going to do it, right? And so we see that when we're not having a good lifestyle, these symptoms worsen, right? And so what this paper talked about was if we have these interventions that include those things on that previous chart, right? That symptoms don't progress as fast as they would have without. And we see improvement in a lot of these non-motor things, the things that get in the way of us actually doing the things that we need to do. And so that, again, this began to set into motion these conversations about lifestyle mattering, and more importantly, beginning to look at the so what, right? I think that's always the question in research is I think across the board, a lot of us, me included, do a really good job of descriptive research, describing a problem. And I'm kind of the belief that I don't really want to know the problem if you can't tell me a solution to it, right? It's like telling me that I have a gene that I'm going to have cancer in the next 10 years, but there's nothing I can do to prevent that. Do I want to know that, right? So I think that the research is beginning to move in that direction of saying, all right, these are the things that we know that need to be different. Now here are some interventions that we can do that are going to make a difference. And the piece that's coming out of that is the in-clinic interventions, right? Indu Subramanian, whom I work with on most of my work, who was here, I don't know, a year and a half ago, she's always asking me, she said, Brad, what can I do in clinic with my patients when I have 3 extra minutes to talk to them, right? What are the questions I can ask them, some things I can ask them to do that make a difference, right? Because time is money in medicine, right? We know that's a problem. And so those are the things I think we're getting to in the research, beginning to talk about some of these things that are truly important. So I think that what we see is, and I talked about this, that quality of life is multifactorial, right? The medical side looks at measuring motor symptoms, right? You go in to see your movement doc and he has you do all the UPDRS stuff, pulls you back, retropulsion, all of those things determine, that's kind of how they decide how your quality of life is. They have a score and they go, you're worse or better than you were 6 months ago. We're going to change your Cinemet, whatever drug it is you're on, and we're going to up the dose. It's going to help with that, and then we'll see you in 6 months, right? That's an important component of treating Parkinson's disease, right? But I think the way we in this room probably see quality of life is, how do I feel emotionally? Am I engaging in things in life that I want to engage in? How's my stress, right? Who am I? Identity is a real issue, right? Identity changes when you get the diagnosis of Parkinson's disease. May not right in that moment, but over time it does. Because we change physically. The things that we can do change. Who I am might change. So it's another area that hasn't really been tapped in the research yet that we have on our plate of things to look at. But I think getting to what is it that helps me maintain quality of life or improve my quality of life is whether or not I have agency, whether or not I have the ability to make my own decisions to do the things that I want to do, right? When that's gone, quality of life goes down, right? When I can't engage in life how I want to, things don't go nearly as well. And so I think the key to this kind of today, the bottom line is motor symptoms are only one piece of the story, right? And there are a variety of clinicians who can treat Parkinson's disease, who treat different aspects of this. We'll talk about that a little bit more in a second. But we published a paper last year about demoralization, which is this whole other construct that hadn't really been talked about a lot in Parkinson's. It's feeling of helplessness, hopelessness, loss of meaning that can happen. It's not depression, but it's like depression. The diagnosis is a little bit different. But we've got a Parkinson's patient named Barbara Matthews, who is an artist. And so we published this paper and we had a figure in it, and she saw it and she said, "Can I draw you all one that hit me?" And so she drew this. And so now Indu and I both use this when we talk about demoralization, because I get that. You all probably get that. Those emotional reactions to not only the diagnosis of Parkinson's disease, but the progression of Parkinson's disease, how it affects my day-to-day functioning, how it affects my relationships, right? And these things, these mental health challenges really do affect quality of life, right? And oftentimes they're challenging to treat. Depression we can treat. We've got SSRIs and SNRIs that are fairly effective in treating true depression. Anxiety we can kind of treat with some meds as well. But this idea of demoralization and grief, what do we do with grief? You can't give somebody a pill to treat their grief, right? We've got to do some type of behavioral interventions to help people begin to deal with some of these things. And one of the things that comes out of a Parkinson's disease diagnosis, particularly because it's such a heterogeneous disease, right? We don't know if someone asks, "What's my Parkinson's going to look like in 5 years?" How do you answer that? Because I know people who have had Parkinson's for 15 years who are doing fairly well. I know other people who have Parkinson's for 3, and they're really struggling with a variety of things. And so that leads to this idea of uncertainty. And really, when it becomes challenging is that when someone doesn't have the ability to navigate uncertainty and they get stuck in that, right? And so we've got a paper right now that's in press or in revisions with Movement Disorders Clinical Practice, where we talk about this issue and we talk about the things that lead to this intolerance of uncertainty. And it's my motor symptoms, right? When am I going to have an off episode? I want to go out and I want to go to this event, but I'm concerned that I'm going to be off and I'm not going to be able to function as well. Things like incontinence, which is a real issue with Parkinson's, right? I'm going to go to this event, but I'm worried about that. How's that going to go? What about my inability to communicate the way that I used to? People can't hear when I talk, or I talk too slowly and they want to jump in as I'm talking, which affects conversational relationships, right? So it's all of these things combined that create this angst around my Parkinson's disease and the way that I can interact with other people. And it's really challenging. And so now we're at a place where we're saying we've got these things, intolerance of uncertainty and demoralization and stigma, which I didn't even include in this talk, which is a whole nother issue, right? Which is associated with intolerance of uncertainty. How are people going to judge me, right? If they see my tremor, if they see my gait is off, are they going to assume I'm intoxicated, right? We see that in the literature that happens. And so then I'm concerned about whether or not I really want to engage because of how people are going to see me. And it may not be true, but it may be my perception, and that makes it reality, right? So those things affect how much we interact with other people. So the question of all of this becomes so what? What do we do about it, right? What can we do to make a difference in these things and help us to better adjust, right? We can't change Parkinson's disease, right? We have basically one intervention that's mildly associated with disease progression or slowing disease progression. It's exercise, right? It's the closest thing we have. Otherwise, we can't do anything to reverse it, to slow it, right? So we've got to figure out what are the things that we can do to better deal with it while I have it. And we're going to talk about some of those. One of those is self-compassion. Kristen Neff is down at the University of Texas, and she's been doing work on this idea of self-compassion for the last 20 years. And really, the easy way to understand what self-compassion is you treat someone how you would treat a friend, right? If a friend came to you and they were struggling with something, you would comfort them. You would tell them, "I care about you. How can I help you? It's going to be okay." Well, even though it's going to be okay is not a great thing to say, but we say that, right? Because we don't know. And so how do I interact with that person whom I care about? How do we learn to do that for ourselves? Right? It's very difficult. I liken it to Forgiveness, right? It's real easy for me to forgive someone else for hurting me, but it's difficult for me to forgive myself when I hurt someone, right? And that's kind of how self-compassion is. So it's a mind shift of allowing us to begin to view myself as someone I love, right? Which can be challenging because we can have times in our lives where we really don't love ourselves, right? Because things have changed. So what Kristen Neff talks about is these three bubbles that you see up there are all components of self-compassion. And it includes mindfulness, common humanity, and self-kindness. And so mindfulness it's an intervention that is effective in so many areas in Parkinson's disease, right? How do I focus on the moment, right here, right now? And it's asking you, what are the things that you're aware of right now? You're aware of me because I'm in front. You're aware of the slides. You're aware of the table. You're aware maybe of the hum of the machines in here, right? It's getting out of past things that have happened already. And it's not focusing on what things that I have to worry about for tomorrow. And when we can do that, it helps with anxiety and it helps with distress and it keeps us grounded. So that makes a whole lot of sense. We see that in a lot of the literature. The common humanity piece, I also think makes a lot of sense, right? Because so often in a chronic disease state, we can feel alone, right? Partly because we can pull back from social connection. And I'm the only one who's dealing with this. And understanding that everybody is struggling with something, right? My problems are different than yours, yet I still have problems. And it's understanding that we're all part of this human body and we all struggle. And so as we begin to understand that, and it's not just me, again, distress lessens, anxiety lessens, and we can begin to engage and understand the situation more. And then lastly, self-kindness. This is interesting because if you look at, we know that there's plenty of literature on if I give you a hug, how it affects you physiologically, right? It's positive. We know this. Now we've got research that says if I give myself a hug, there's a positive physiologic response to that. Interesting, right? So I say hug yourself, right? Easy. We see if you hold your hand over your chest, right? That can also have a positive physiologic response. It helps immunity, these things, right? And they're so simple to do. It doesn't take a lot of time. Maybe writing a love letter to yourself, right? Self-kindness. Simple interventions. And these are the things that I talk to Indu about that have your patients do this. What would you say to your friend who had Parkinson's disease? Write them a letter, but write it to you. Easy, right? I shouldn't say easy. It's simple, but it's not always easy, right? Because it takes effort. And oftentimes we can see something like that and go, that seems kind of silly. I don't know if that intervention is going to work. What do you have to lose, right? The literature is pretty good on what self-compassion does. And so as we think about it, the three steps that I think make a lot of sense that you can begin doing is naming the moment that you're suffering in. This is hard right now. I'm struggling. I don't know what to do, right? Just name it. Name it to tame it is one of the things that Indu says all the time. We've got to be able to identify a problem before we can do something about it, right? In medicine, you've got to know what you're treating before you can treat it, right? So you do some tests and you identify what the problem is. Then you figure out what you're going to do about it. So with this, what is the thing that I'm struggling with? Just say what it is. Oftentimes, if you're like me, that's even challenging. I'm just struggling. I just feel down. I feel anxious. I feel depressed. I don't feel like getting out of the house. That's a symptom of a problem. But what's the problem, right? So learning to think through that process and think what it is that's the underlying issue. Name it. And then begin to think about the mindfulness piece into the moment. What's going on right now? I'm stressing about this event that's going to happen in 3 weeks, and I don't know how I'm going to function there, right? But it's 3 weeks away, right? What can we do right now focusing on the moment with mindfulness? And then just remembering you're not alone. Something happens in community. that is healing for us. We're going to talk about loneliness in a second, and there's a plethora of data talking about the benefit or the negative impact of loneliness on everyone, but we've got data on Parkinson's disease, right? So remembering you're not alone, it doesn't mean that you're not doing well. Just because you're struggling with something, with depression or apathy or whatever it may be, doesn't mean you're bad, right? It means that you're human and you have a condition that causes some of these things to be different in you than it does for other people. And that's okay. Recognizing that. And then respond kindly. I talked about that already. What would you say to a friend? Your friend comes to you and asks you that question. How would you respond to them? Try doing that with yourself. So this is one thing that's fairly simple to do that the literature shows can make a difference. I'm not going to spend a lot of time talking about exercise. I know that Rachel Dolan, done some work with her as well. She was here last time, I believe, talked about exercise in particular. And I think in this room, everybody would agree that exercise is a good thing, whether you have Parkinson's or not. The data on exercise and Parkinson's disease is exceedingly deep and strong. I think one of the things that I work with Davis Finney talking about this is we spend so much time talking about whether it's good or bad, or which one's the best exercise to do, right? The best exercise is the one you'll do, for sure. My question is always, what is the thing that prevents people from exercising? Self-efficacy. I don't think I can do it, therefore I'm not going to do it, right? Though, to me, that's the stuff that we need to treat. What's the apathy that's preventing me from getting up off of my couch and going to the gym or going to an exercise class, going to rock steady boxing, whatever it may be? That's the issue to me that we need to treat because we already know exercise works. So that's my soapbox about exercise for today. But we know that exercise is effective and we know that regular exercise is effective, right? This is the conversation I have with my mom at least weekly. I talk to my mom every morning. She lives up near Washington, D.C. I call her and check on her and we chat. What do you have planned for your day, Mom? And she gives me all of these things. She's very active for an 81-year-old, still very independent. But yet she very rarely tells me she's going to exercise. And I say, is that all you're doing today, Mom? What about, And I don't push too hard because I get it. I get it. She was never an exerciser in her life. So now all of a sudden we're saying that you have to become an exerciser late in life. It's a challenge, but it's important to have some regular. She'll go every other week, one time. Right? Better than none, I suppose, right? But encouraged to do that and make it challenging enough, right? Get yourself sweating. Get to a place if you're walking to where you're breathing heavy, right? We know what that does for the brain, and it's important that we get to that point. So steady, regular exercise. And the lifestyle medicine on that flower that I showed talked about diet, right? And again, I'm not a dietitian, and I'm not going to get deep into diets, but we know basically the two diets that are effective are the mind and the Mediterranean. Those are the two that most people would agree in the literature are the most effective for people with Parkinson's disease and any neurologic condition for that matter. And the mind diet really is more leafy greens and more nuts, right? Olive oil is a good thing. Remembering that there's this gut-brain connection, right? We've known that for a long time with Parkinson's. Does it start in the gut or does it start in the nose? Yes, is probably the answer to that. We're not sure, right? That we know that the Brack hypothesis talks about how it goes from the gut to the brain, and we see that happening, but we still are figuring out, I think there probably are two ways, is when I talk to experts about that they say, yeah, you might be able to get it through the environment, through a smell, and you might also be able to get it in your gut. So again, that's not my expertise. Diet matters, and drink, right? Drinking water matters to help keep us healthy. So this is kind of where this is getting into really my research area, meaning in life, right? I know I started researching meaning in life when I was in grad school and I read Viktor Frankl's Man's Search for Meaning. One of the most powerful books I've ever read. If you haven't read it, I strongly encourage it. Understanding this guy's journey through Nazi concentration camps in overseas, and he was in Auschwitz and Dachau, I think 3 different camps. But he talked about he began wondering, what is it that allows one person to make it through that while others die? We all have access to everything the same. None of us get food that's worth anything, right? You get like a cup of soup that's really water every day, but some live and some die. And the idea that came to him was, and he had been working on this really before he got into the concentration camps, was people who have purpose do better, right? And it's really from Nietzsche. Nietzsche started talking about that. He said, the man who understands the why can bear any how. I have a purpose to live for. I can deal with what I have to deal with to help get me through. And so that became an area that I thought, this is fascinating. How can we look at this in people with Parkinson's disease? Because I think it happens, right? I talked about identity loss. Most of the time when we meet someone new, the first thing we ask is, what do you do? Right? And that becomes our identity to some degree. So let's say you are diagnosed with Parkinson's disease and you can no longer do the work that you've been doing, and that's been your identity for 25 or 30 years. What happens now? The question becomes, who am I? Right? And that was my purpose for so long, and I can no longer do that. And so identity goes down. I begin feeling badly about myself. I'm not worth anything to anyone anymore because I can't do those things that I used to do. And the negative cascade begins to happen because we have role changes, right? Maybe you were the primary breadwinner in your home. You got diagnosed with Parkinson's and you can't. Maybe you were the primary caregiver in your home and you got diagnosed with Parkinson's and now you can't do all those things you used to do. So role change happens, right? And so my meaning changes. And then there's the uncertainty that we talked about, the grief that can come. Grief is an interesting thing, just as an aside, right? Grief is, Kubler-Ross studied the stages of death and dying back in the 60s, and she talked about it being a longitudinal thing, and it's not, right? It's cyclical. And that's kind of how grief is. You feel good, and then you go back to a denial, and then you have bargaining. You have the same kind of stages. But grief is an interesting concept that creates a lot of anxiety, and it creates this thing of, I heard an expert talking about grief, and he said the challenge with chronic illness and grief is that when you lose a loved one, that begins to fade over time. But when you're in the middle of a chronic illness and you have grief, you're faced with it every day. And you get that reminder all the time, every day, right? And so these things get in the way of our meaning. My meaning may be affected by my participation. This group that I was in was part of my identity, right? Maybe it's a church group that you were in. Maybe it's an exercise class that you did, whatever it might be, but that's part of your purpose, and maybe you can't do that anymore. Your participation wanes. And so meaning is critically important, and it's very much tied to our values, right? So when we think about the question that I get typically when I talk about this is, how do I find meaning, right? And there are many ways to find meaning in life. There's not just one route to it, which makes it beautiful. And so on the left side of the picture there, you see that tree. And these are just examples of what are values to people, right? My value may be openness. It may be honesty. It may be trust, whatever it may be, right? Each of us have different sets of core values that we hold at our hearts. And so the key with meaning in life is, number one, identifying what your values are, right? Because you can't act out a value if you don't know what it is. Well, you can act it out, but you can't actively engage in that value if you don't know what it is. And so if we can find our values and then find things that we can do that align with our values, we can find purpose. We can find meaning, right? And so that's the simple solution to that. If your value is openness and you really hold that dear, find people in your life whom you can be open with. That becomes meaningful to you, right? It's important to do that. So begin thinking about that maybe as you leave here today. What are the things that you value? There are a variety of things online that you can go and you could do a values test. There are scorecards that you could look at that you could say, check the things that are values to you. It's an interesting exercise to do, to begin to learn what your values are. And, I've got that idea of changing the vehicle because going from gardener to mentor, right? The way that I used to exercise a value might change. I can find something new to exercise that same value that I can do today, right? So even though I have Parkinson's, or I'm now a care partner for someone with Parkinson's, and the things in my life have changed, it doesn't mean things are gone. There might be pieces that are, but let me find a new way to do some things that I never thought about before. It's one of the interesting things that I find about Parkinson's is, I meet a variety of people. Art is a big thing in the Parkinson's community that I see, right? And so many people that I talk to who have begun art didn't do art before they were diagnosed with Parkinson's. All of a sudden, they get diagnosed and they're searching for meaning. What is it that I can do that brings my life meaning? And they're thrust into art, and all of a sudden they love it, right? And so it's finding that thing. What is that thing that's valuable to you? And when you find that, one of the counseling, there's a theory in counseling called solution-focused therapy. And I know you know this, but it just says, find what works and do more of it. And if it's not working, stop, right? I mean, that's a very simplified way of doing that, but it makes total sense, right? So find what brings you value and engage in that. The other thing that happens, the last slide, we talked a little bit about decreased participation, and that could be something that we value, but connection and participation oftentimes goes down post-Parkinson's diagnosis. And I think before Parkinson's, there was a general understanding of the challenges of loneliness, but man, have we made a leap since we had COVID. I think I said before Parkinson's. I think I meant to say before COVID. Since COVID, the literature on loneliness has blown up, right? Because most of us probably experience loneliness. And it's important to make a distinction between social isolation and loneliness, right? Social isolation is a state. Like I'm home, I'm by myself, I'm isolated. But that doesn't mean I'm lonely, right? Versus this room here today, nobody in here is socially isolated, but there could be people in this room right now who are lonely, who don't feel that subjective, qualitative connection with other people. And loneliness really is that gap or that difference between the connection that I want and the connection that I have. I want to be really connected with other people, but I'm not. And so I feel lonely. And so the literature that began coming out after COVID, and again, Indru Subramanian did some of this work with Lori Mishley, looking at what role did loneliness have on Parkinson's disease symptoms. And what they found was symptoms got worse, increased by 55% for people who were lonely. So loneliness matters. The other interesting finding, and it's weird in the paper the way that they describe it, but loneliness is as bad for you as exercise is good, right? So if exercise, on a scale of 1 to 10, if exercise increases your life with Parkinson's disease on a 10, loneliness will decrease it by a 10, right? It's critically important that we have connection. And it's one of the challenges that we run across is these things, some of these symptoms that I talked about, prevent connection, right? And can get us lonely. Again, the apathy, the depression, the anxiety, the motor symptoms that may be uncontrolled, off periods, right? Those things can prevent me from connecting with other people. Therefore, loneliness sets in. And loneliness will, I think I didn't have that slide in here. Thought I was going somewhere else with that. But the question becomes, what I'm talking about is things get harder with Parkinson's disease to connect, right? We've talked about the motor. What about the voice changes, right? Voice gets quieter, harder to understand, right? I was talking to my dad, and both my mom and my dad, and my mom says, I think your dad's hearing's getting bad. And I'm like, well, maybe, right? He's 83, but maybe, or you're just talking so low he can't hear you. Or the other factor when you're married is you're just not listening, right? Which I'm accused of all the time at home. I hear, but I don't always listen, right? So vocal changes in facial expressions, right? The facial masking, right? When someone is having a conversation with someone with Parkinson's disease, they may look disinterested, like they don't really care. There's just no expression at all, and that can be misconstrued, and therefore that can affect participation, right? It might make people not want to engage as much with you because they think you don't really care to talk to them, right? So it's beginning to think about these things. Mood and motivation, I already talked about. Cognitive changes, right? How does my short-term memory getting worse affect my ability to effectively communicate with other people? It does, right? I can't remember a conversation that I had 5 minutes ago, right? When I talk to my mom, she can tell me a story at the beginning of a conversation, and she'll tell me the exact same story 15 minutes later, right? Which I let her tell it, right? But that can affect other people that in a community setting, in an engagement setting. Stigma, we kind of talked about that. Stigma is a real issue. 50% of people with Parkinson's disease report they've experienced stigma. Care partners also can struggle with the stigma piece, right? Because of how the person whom you love is being judged can affect you. And maybe say, how does that make me look, right? Because we all care about how we look. There's that little piece of narcissism that's in, it matters about me, right? And so stigma can affect both. And then just general logistics, driving problems, right? You want to go to a support group, they don't have an online option, but I've got to get across town and I don't drive. Find an Uber, right? Those are expensive. Can you figure out other ways to get around this stuff? Caregiver schedules, right? If I need my care partner to help me get to something, but they have an appointment, then what? Right? Then I can't connect. So beginning to think about this stuff, and one of the things that we've also written about is this idea of social prescribing, right? As a provider, prescribing engagement, prescribing exercise, just like you prescribe the medications. And so we started talking about this in a few papers, and it led us to another conversation when we said, well, that's great, but what about the logistical piece? It's great if I tell you that you need to exercise, but what if you don't have a way to get to exercise? And you live in a rural area and you don't have any online connection to where you can do it that way. Yeah, you can go out and walk, right? I get that. But there oftentimes are things that get in the way of that social prescription. And so we looked at the loneliness scale and broke it down, and it's in review right now where we're looking at these two different camps that need to be considered with loneliness, right? It's not just the social connection piece, not just the emotional aspect. It's the logistical aspect that we also need to consider. And maybe with that prescription, I need to also make sure I understand what gets in the way. And is there a way to address that? And if not, I change the prescription, right? So it's this holistic attitude. So small ways that you can stay connected. For me, if I don't plan it, it doesn't happen. Right? Brad and I were talking about this earlier. If I'm not intentional about things, I'm really good at telling people we should have lunch. Right? And it's great. They go, yeah, we should. That sounds awesome. And it just doesn't happen because we're all busy. And if it's not on my calendar, it's not something I have to do today. So plan it. Make it a regular thing. We're going to have a conversation with a friend once a week, right? Maybe it's every Thursday morning at 10 o'clock. Whatever it may be, have a plan in place so that you can do that. Realize that the engagement doesn't have to be an all-day engagement, right? Because fatigue is a real issue with Parkinson's, right? What you maybe used to be able to do as far as timing, you might have been able to do a lunch that lasted an hour and a half. Today, you might not be able to do that. Maybe it's just coffee for 15 minutes is all you can do. That's great. Something is better than nothing, right? Even those short connections are exceedingly valuable for how they make us feel. Make sure, I think one of the other things that's difficult is when we have communication struggles with someone, sharing with them what would make it better, right? Like, I'm having a hard time following. Could you slow down a little bit? Because I'm not able to process the same way that you're processing, right? Give me a second to respond, right? Most of us in conversation, we're really good at I speak, you speak, I speak, you speak. We just go back and forth. It's a little different often with someone with Parkinson's disease, right? That maybe we have to give them a little more time. Even maybe we need to be in a quieter place, right? We talk about when you're at home, maybe it's turning off the electronics, turning off the TV, so we can sit and actually have a conversation without me watching the ball game and my wife over here talking and I'm just shaking my head, right? What is the solution to that? The solution of that is to change my focus and begin to be intentional about how we communicate. And then keep one group, whatever it may be. Maybe it's a spiritual connection that you have in a church group. You know, when you look at the things that give life meaning throughout the research, there are only a few things that are very common: work, relationships, and spirituality. Those are the top three things that you see pretty much across all the research. So there's value in that. So whether it's a Parkinson's support group, something like this, whether it's an exercise group, whether it's speech and language, whatever that is, find a group and engage, right? Those are fairly straightforward, simple steps that I can also do better about doing. So when we think about, again, treating Parkinson's disease, Miriam Rafferty is up at the Shirley Ryan Ability Lab up near Chicago. And they published this paper last year, and I loved this graphic, right? It's looking at all of the things that need to be addressed when dealing with someone with Parkinson's. However, there's some stuff missing when I think about this, right? So let's talk about what that might be, and I'll show you my new picture that we developed. So care partners are a critical component with Parkinson's disease, right? In the same thing that I tell any counseling students is you can't pour from an empty cup. So if I'm not okay, you're not okay. And so it's important for the care partners to take care of themselves also. Have time away. Maybe respite is needed. Maybe asking for help with giving your loved one a ride to an appointment, to something they need to get to, that I just need time off. Maybe it's just having lunch with a friend. Maybe it's having a conversation with someone where Parkinson's isn't the topic, right? Because you spend so much time talking about Parkinson's, thinking about Parkinson's, and someone you don't have to tell the story to. Oh, my spouse has got Parkinson's, and they were diagnosed here, and this is what's going on. How about let's just talk about something that's going on in your life, right? That can refill us and give us the energy and the capacity to re-engage back at home and do the things that are needed with our loved ones. So I think that's a component that was missing from her depiction of treating Parkinson's. So I changed it a little bit. Things that are on this sheet that weren't on the other one. What are the values? What are the things that still matter? I think if we're treating holistically, these are questions that we need to ask. What about advanced care planning? Has that been talked about? It's a part of understanding the disease holistically. Palliative care needs, I think we need to talk about those. Caregiver needs, right? You know, I asked my parents, my mom she's now with her, I think, fourth movement disorder doc. They've moved a couple of times, but she's at Johns Hopkins now. And before she got to Hopkins, I had asked my dad, I said, Dad, when you guys go see your doc, has anyone ever asked you how you're doing? And he said, no. Interesting, right? And I'm like, what a simple question for a clinician to ask a couple who's sitting in front of you. How are you doing? It's not his job to treat my dad or her job to treat my dad. But as a caring clinician, if you want to take care of my mom who's your patient, you probably want to know that the person who's helping out at home is doing okay. So if nothing else, it's just asking that question. And if they're struggling, say, maybe it would be worth you seeing someone. Have you talked to your primary care about the depression or the anxiety that you're dealing with? Maybe counseling would be an option that you might want to consider along the line. So I think all of these things are important as we talk about how to holistically manage Parkinson's patients And when I say that, I mean the family, right? Because Parkinson's is not an individual disease, right? It affects everyone whom it touches, right? So it's important that we consider that as we deal with what's going on. So, thinking about the week moving forward, ask yourself these questions. One practice I can use every day. Maybe it's being kinder to myself. Maybe it's understanding, giving myself grace that I don't have to be perfect. Right? I have Parkinson's disease, or I'm living with someone who has Parkinson's disease. There are struggles, and that's okay. It's normal. And I'm not a failure because of it. One role or value you want to keep living out. Again, I talked about that values list, right? Look up a sheet about determining your values. Maybe figure out your top 5 values to you. And then figure out, are you engaging in activities that support those values? Or are you engaging activities that are contrary to those values? That's going to be problematic, right? If, we'll just use a crazy example, if one of my values is trust, and the relationships that I'm engaged with, I'm dishonest with everyone. So your value is not trust, right? I mean, there's a problem there. And so meaning is affected because I'm not living according to my values. One person or group that I can reach out toward this week, right? Maybe it's a friend that you've lost contact with. Send them a text, call them on the phone, reconnect, having coffee with someone, having lunch with someone, getting into a group and connecting. Social connection is so essential, right? So thinking about some of these, again, I say they're simple things. These things make a difference. The literature is clear. The work that's been done shows that these things improve quality of life outcomes for people and care partners around Parkinson's disease. Treat the disease, protect the life, right? Parkinson's is a disease, but we still live, right? We're still going to function in society to some level. And my goal is to continue to find things that can help you do that better, more effectively. So that's all I've got. I'm happy to answer any questions or anything you might have. But thank you for the time.
Thanks, Brad. We'll open up the floor for questions now, and I'll come around and hand you the microphone if anybody has any questions for Dr. McDaniels.
Clear as mud. Oh, got one over here, Brad. Sure. I can send them to Brad. And I don't know how Brad disseminates stuff.
Well, Brad,
Yeah. I'm happy to. Nothing in here is proprietary. You can do with it what you want. So, for sure.
Okay.
Okay, we're new to Parkinson's, only about 8 or 9 months, but finding the right neurologist seems to be a struggle. You have any suggestions?
I'm hearing a common name. My answer to that is always have conversations with people who have been there, right? I don't see these people as a patient. I know them personally, and just because I like someone doesn't make them a great clinician, right? So I would say have conversations with people in the room who have been seeing someone and they're really happy there. There you go. And I do hear wonderful things about him. Yep.
Anybody else?
Speaking of doctors, what's the difference between going to a neurologist and going to a movement disorder specialist?
A lot. That's the simple answer. It's just the training, right? A movement disorder specialist is a neurologist who's gone through years of training just focusing on movement disorders, right? I think that if we look at the data, I think we're down, it's under 50% of people with Parkinson's are actually seeing a movement disorder doctor, which is, I would highly recommend that. They just have a much more intricate way of understanding Parkinson's disease versus getting a few classes about Parkinson's and have a neurologist is equipped to deal with Parkinson's disease, but they don't understand it nearly as deeply as a movement disorder specialist does. So I think it's important to see one. Hmm. Great.
I think we have a question back here.
Hello. I actually work in skilled nursing, and there's always misconceptions about Parkinson's. And my question for you is, how can long-term care facilities and skilled nursing teams improve their approach to residents living with Parkinson's, especially around mobility, cognition, and behavior changes?
Yeah, well, that's a lot of a question to to address there. I think it's important, right? And again, it's understanding this whole holistic piece. It's making sure that you have people who are there who are specifically trained to help with movement, right? I mean, there are a lot of PT people who are good at PT, but there's a difference between a physical therapist and a physical therapist who works with neurologic conditions, right? So I think particularly with Parkinson's disease and other neurodegenerative disorders, there are some things that are important for a physical therapist to understand about that condition that makes them better equipped to help the patient get what they need. I think making sure that there are even having social workers available, counselors available, who can have these conversations about the issues around mood, right? Depression, anxiety, apathy, the things that get in the way. That's important. I think having opportunities for them to be able to engage, and I think that happens pretty regularly in those facilities. But again, when we're talking about neurologic conditions, that engagement is critically important. So, and even having people having the ability to engage with others who have the similar condition, right? Because it's a struggle when you go to someone with Parkinson's goes to a let's just best example is someone who's at a similar place in their disease process, right? And I've talked to people who have young onset Parkinson's, and they go to a Parkinson's support group, and everybody there is in their 80s, and they're at a very different stage of life. So having that group of people who are talking about their similar concerns at a similar time is important. So I think making sure that you've got the professionals there who can at least guide that process, whether they're fully employed there is a different issue, right? But bringing those people in maybe on a weekly basis, maybe it's a group meeting that's led by a counselor or a social worker talking about what are the struggles that we're having and that specific physical therapy. So I think those are some general things. Yes. Parkinson's.org. Yeah, Dan says there's some great training on there for that. Yeah. Yeah, you can just zoom through that because it's probably not that good. He said it was me on there, so that's why I said that.
I just had a quick question. Oh,
What's that? It does. The challenge with that is it vetted, right? Because there's so much information out there. So much that I see on YouTube, I'm like, really? Right? AI is a real thing now. We know this. And so not everything I see is true. And we get people on YouTube who are experts in Parkinson's disease who are making recommendations. And, so when you go through Parkinson's Foundation or Davis Finney, American Parkinson's Disease Association, those places are vetted, right? And the stuff that they're putting on there has been agreed upon by a board or someone who really understands the disease. So just be cautious where you're getting your information. But you're right. There is a lot of these talks that are on Parkinson's.org are also on YouTube. So you can find them. Yes, sir.
you talked about a lot of stuff. I'm thinking kind of the top tier pieces are connection and exercise. Okay, let's say that we do those things first. We work on those things first. got a lot of other pieces. Like say there's 9 realms in that flower.
Yeah.
Right? Okay. So what do you have like a tier list? You know, like
Ooh.
you can't do everything at once. Do you have what do we do next in your head, or how do we figure out like what the next step is after
Yeah.
we work on those first
That's a great
pieces?
question. I think if I'm looking at the order of the things that matter, exercise has got to be at the top, right? Because it's the one thing that we have data on that shows that it's potentially disease modifying, helps with cognitive function, and also helps with physical functioning. So exercise makes the most sense to have at the top. Now, the other things, I think that diet is probably close to the top because diet affects mood. Diet affects my fatigue. It affects my ability to engage. So if I said social connection is the most important, but my diet stinks, I'm probably not going to engage socially. So I would put diet up there as well. The other things on that list, let me just get back up there so we're all looking at the same thing. You know, I don't know that it's really difficult for me to say how to order those. From my perspective, from my research, I would say meaning has got to be up at the top of that list. Meaning and social connection are at least in the top 5 on that list because those things, again, we have data. There's actually data on meaning in life that people who score in the highest quartile of meaning in life have lower odds of mortality. So yeah, meaning in life, pardon me? I think it's critically important. On a list of top 10, I think it depends on the individual because not everybody needs it at the same time, right? But I think that as soon as earlier is always better, pretty much for any treatment that we engage in. I think as soon as one begins to realize that there's trouble with speech, your loved one brings it up, I think it's critically important to begin getting involved early on. But again, that speech and language issues affect communication, which affects my participation, which makes me lonely, right? So I think, again, and that's one of the challenges with PD is the heterogeneity of it, that it's different for every person. And my struggle may not be the same as yours, but whatever my struggle is probably what's the most important thing for me to deal with. So I kind of vaguely answered your question, but it's really tough to order those. And especially because my perspective is a lot of it is around the research that I've done and the research that I've read. So it's tough, but it's a great question. The easy answer is they're all important and they all should be on the top line.
You spoke about the meaning and relationships and spirituality.
Yeah.
Where would spirituality fit
On that list?
on that list? On your list that you're creating, top
Yeah.
10?
So let's say I put meaning as third. Spirituality would be 3.1.
Okay.
Because again, when we look at the literature on meaning, it's work, relationships, and spirituality. So there's just a new paper. And again, my colleague Indu Subramanian just published a paper on spirituality and neurology. And it delves into that about what do we know about how much spirituality affects quality of life and positive outlooks. And it's a solid, very high correlation between people who have some type of a spiritual belief. And again, it's important that we understand that spirituality is not necessarily religion, right? They can be the same, but they're not. And so we have to differentiate something that's liturgy versus something that is a spiritual connection. But I think undoubtedly, spiritual connection is a great thing for meaning and for positive outcomes. And again, that can be very broadly defined. Like what you say, what do you mean by spirituality? It's a connection with something outside of you, right? Depending on who you listen to, is it a spirituality can be a connection with nature, right? Some people feel very spiritual when they're in nature. It may be a connection with God. It may be something else, right? But we know that association is very high. And so I would definitely put that in the top of my list, at least to consider. Hey, Andrew.
My experience as a caretaker, so my dad was on hospice for a year and a half. And just based on everything you've talked about, the most holistic approach to his care was from hospice.
Yeah.
So my question is, earlier on in the game, right? So childbirth, there's doulas and stuff like that. You can get somebody to help manage the entire experience from the beginning to the end.
Yeah.
Do we see something? Are those people available that can help with the holistic experience?
You know,
Go ahead. You understand what I'm
yeah, I
getting
do.
at.
And I think it's one of the challenges that we have is that we have a lot of people who are specialists in one area, right? I'm going to go see someone for PT if I have motor issues. I'm going to go see someone who's a speech and language person if I'm having that issue. But to find that holistic care really is challenging in the movement disorders world right now. I think the closest thing that I've seen to that, when my mom was diagnosed at the University of Kentucky, any new diagnosis would go directly from the neurologist, movement disorder doc, right into a room with social worker. And they would talk about those things. And I thought, how valuable is that? And I've had that discussion with several docs in the area, and the problem is always funding, right? How are we going to be able to bill for that and make it pay its way? But that's, to me, that's a wonderful solution, is at a new diagnosis in particular, is understanding how this disease is going to progress and things that I need to think about moving forward before we get to that place. Right? Yeah. Yeah. Here are the expectations, and one of the things that she did that was so well or so good was she said, how much information do you want right now? There's so much, right? You could send them to parkinsons.org and it's like, where do I even begin? And so it's having someone who can spoon feed you. Here's what Parkinson's is. Here's kind of what you can expect moving forward. And let's have a routine meeting where we talk about these things. And as you have life changes, let's make sure we're addressing them in real time rather than trying to do it, in reaction, which is always much more difficult. But I think it's a great question. And Bas Blom in the Netherlands is the one who's doing the best job of that. And it's their medical system. Their medical system allows for this whole holistic care where you come into a building like this and you've got every specialist you need under one roof and you're seeing them all together, right? Our system here doesn't do that well. It struggles with a whole lot of things, but that's the best way if we can ever get to that. But it's a great question.
One of the things that I suffer from is significant sleep disruption throughout the night. And it's always listed as a problem with
Yeah.
Parkinson's. I was wondering, are other people here, do other people suffer from that? The sleep disruption. I mean, constant. If you look at my sleep at night, it's red all the way across. I do get a lot of sleep, but I'm awake all the time. And that specific thing seems to affect every leaf on that. If you don't get enough sleep, you don't want to do anything.
Yeah.
Getting up this morning to come here, it was difficult. It's challenging to do those types of things. So I just wondered if that was a constant throughout the community of people with Parkinson's.
I
what do
think
you
you'll
do?
hear that it is in this room.
Yeah.
And it goes back to your question, right? How do we rank order these? Right? Because here we go again, that this affects that affects that affects that. And so which one do I deal with first? I think sleep is a real issue. I think Dan could answer that. Anybody in the room who's suffering with Parkinson's, I would bet, would say, yes, sleep is a problem, right? It's a real issue.
Well, it's good to know that I'm not the only one doing that.
It's not
because
you.
When you don't know a lot of people with Parkinson's, you don't have anybody to ask a question to.
Yeah.
And normally
I
your
hear it
doctor
regularly.
doesn't know what to tell you. When
Yeah,
it comes
I hear
to
it
that.
regularly.
Thank you.
Yeah.
I imagine there's at least one person in this room that will come talk to this gentleman about sleep before this is over, right? You're going to know somebody by the end of this. Yeah.
What a great way to create a social connection. Common problem, right?
So you mentioned the differences between a movement disorder doctor and a neurologist, and
Yeah.
you kind of lean towards a movement disorder, what is it common to be having to go both? I mean, I like going to a neurologist, but is it better to go? You said it was kind of more leaning towards a
For Parkinson's disease,
yes, uh-huh.
yeah, for Parkinson's disease, the movement disorder doc makes the most sense.
And it's not common. I mean, is it common to have both or just one or the other?
I think I'm not, I don't know for sure unless there are other issues that you're dealing with that are neurologic, that might require you to see.
Gotcha.
One of the answers we've heard here is it depends on what your insurance will pay for.
Great point. Great point. From a Parkinson's perspective, I don't see the reason why you would go to both, because a movement disorder doctor can do everything a general neurologist can. They've just done a little more. The jackhammer is beautiful. That's just helping with
I thought it was just me.
the ambiance. Yeah, right. It's helping me think better.
Okay.
But yeah, I'm not sure I see a reason to do both.
Okay. And I had a follow-up question. So I was diagnosed 2 years ago. So I'm kind of one of those analysis paralysis type person. So I've been doing a lot of research online, and there's a lot of Parkinson's organizations like in Europe, in Canada. What are your thoughts as far as other countries versus the United States, as far as research and progression and medicine and things of that nature?
Research is solid around the world on Parkinson's disease. Again, I mentioned the Netherlands. Bas Bloem does some of the best research that's out. I don't know that I would say that there's a country that does better research. Canada's got their people who are doing really well. We've got Annette Schrag over in Europe who's doing wonderful work. We've got Bass. We've got people here in the United States. I think all of it has value. And I think that you'll see, if you look at Journal of Movement Disorder Society, Journal of Parkinson's Disease, you're going to see researchers from around the world. Brazil, we've got researchers from Brazil who are doing great work that we're seeing published in these peer-reviewed journals. So I think I don't know that I would say that one's better. There might be more research coming from the United States than from Brazil, which there clearly is, but I don't know that it's qualitatively better or worse. I'd say it's more common. That's a tough question to answer. I don't think that when I look at the research corpus that, Brazil is only doing one kind of research. I don't think that's the case. Or the US is only doing one, or Europe's only doing one. I think it's pretty broad, and there is a lot of crossover. And really, there's a lot of collaboration, right? On many of these papers, you're going to see someone from the United States, someone from London, and someone from the Netherlands, all together working with patients in this data set, trying to answer some questions. Yeah.
So feeding off of his question on movement versus neurologist, one of the things that I've found talking to other people in the community is, there's a lot of shopping for doctors because not all neurologists are the same, and you have to find one that understands Parkinson's. And it may be that in your market, a movement guy may be better than neurologist because of the understanding of Parkinson's.
Yeah, and the opposite of that is true, that you may live in an area where there's not a movement disorder guy. We've got problems with enough movement disorder doctors coming out of school being trained to treat the expansion of Parkinson's that we're seeing, right? We're at 12 million worldwide right now, right? And we're going to see that double in the next 15 years. And so we've got to have movement disorder docs available who are treating that, and we just don't have enough. Not only because we don't have enough, someone asked about, you talked about Schumacher's number, try to get into UTSW, right? To see a movement disorder doctor as a new patient, right? It might be a year and a half before you get in the door. And so you may end up going to see a general neurologist because you have better access to that person. And again, I'm not saying they can't treat you well. They're a neurologist. They've been to school for a long time. There's just a different type of expertise with that movement disorder doc if you can get in to see one. And I think your other point's well taken, is connection with that provider matters, right? Being careful. Just because you have movement disorder after your name doesn't mean you're great at treating patients, right? Just because you have MD after your name doesn't mean you're a great doctor. It means you graduated from medical school, right? So it's finding that clinician whom you connect with, whom listens to you, and who does the things that you need them to do. Finding that person is critically important.
So Parkinson's has a lot to do with balance, and I was wondering if there's a correlation with Parkinson's and vertigo.
Parkinson's and vertigo. That's a great question. It's outside of my realm. We might have somebody here that could answer that, but I sure can't. Great question. Valerie, can we put you on the spot?
Vertigo is usually an inner ear issue. And so your risk for vertigo, different kinds of vertigo, goes up as you age. So does your risk for Parkinson's. So they're not directly related, but the risk factors are there. If people with Parkinson's have dizziness that's related to their Parkinson's, it's usually a blood pressure issue, an autonomic nervous system issue. Make sense? So
Thank you. That's exactly what I was going to say, but thank you, Valerie. Appreciate that.
Speaking of exercise,
Yeah.
So who had Dr. Schumacher's private number in case you can't get in for your...
all right.
We should have just made sure Schumacher was here sitting at a table and he could have just
100%.
set up appointments before we were done.
We should also get some sort of like kickback from it
Right.
or something. Yeah. It's the best advertising he
Right.
could have. I'm coming. I'm trying to make it through the maze.
So one of the things I'm finding out is there's a lot of information out there, there's a lot of groups out there, a lot of activities out there. It's finding them. Do you know if there's a concerted effort to have like a DFW group, newsletters, support group? Because I mean, I just recently found out about the support group at the hospital in Fort Worth, but there's others out there, I'm sure. So it's getting the information.
Here we go. We got somebody here who can directly answer that question.
Oh boy, I'm not good at this. From a personal need, when Nancy and I moved here 3 years ago, we were part of a support group, and we were having a hard time finding it here. But through physical therapy, the group, you mouth off about something a long time, you end up owning it. So we started a group, and Clear Cut Rehab gave us the space, the support, the literature, the connections. We meet the second and fourth Tuesday of every month, from 10:15 to 11:30, and the first Tuesday of every month we have people come in and speak to the group. We keep 2 sessions open for the caregivers interaction and the patients interaction, but then we come together for the speakers. This, quite frankly, I don't know how to word this, but this has probably been one of the most effective meetings I've come to with this kind of topic. That I like to say we're snowflakes with Parkinson's, because everyone's unique.
Yeah.
How do you dress sleep? You'll probably get 6 or 7 suggestions, and none of them work. But we're like snowflakes. But the thing is, we're all in this snowstorm together.
Yeah.
And we say we're on a journey, and so we just try to sit with each other and say, "Hey, what's up? What's going on?" And we learned a lot about the doctors through the support group. It's people need to go somewhere where they know you understand, and that's not a caretaker's fault that they don't understand. But when I can look at people here out of our group, I can say, I don't feel good today, and they know why. But it also, I think the question of spirituality back here, the spiritual aspect for me is it gives me hope, because that's all we got to go.
Yeah.
Is hope. I'm sorry. right here, we got a table out front that y'all were gracious to give us at last minute, but we're still discovering. So come on.
I think also Brad, you and I talked about it at the beginning. They're still on the website for TCU is Endeavor Parkinson's, I think is what it's called.
Endeavor Parkinsonology.
Yep, exactly. And there's a ton of stuff on that as well that talks about providers and groups and physical therapy and occupational, right? So
And I think I worked with Chris Watts years ago. Valerie and I worked with Chris when he was first coming up with the Endeavor Parkinsonology concept. And speaking to Alan, your comment of very nice words about your dad and Chris as well. Thank you for those. But Chris's gift was in caring about the Parkinson's community. And he was a real champion. He was a friend of the Parkinson community in Tarrant County. And he, to a certain extent, he was the community in Tarrant County. And the Endeavor Parkinsonology morphed into an online resource to connect the local Parkinson's resources. But one of the challenges that we've had specifically in Tarrant County is a central point for all of the different resources, right? And so meetings like this, I think to your point, looking around, there's a ton of stuff everywhere, but at the same time, you can't find it, right? Or it's not descriptive enough. And Parkinson's is hard. Parkinson's is a full-time job. It's a lot of work. And so I think I would look to TCU. I think TCU has a prime opportunity for a lasting, meaningful, robust connection of the Parkinson community. And I think that's what Chris's vision was, certainly with including the medical school, which didn't exist until recently. But I think there's a real opportunity for TCU to be a leader, a nationwide or international leader in the Parkinson's community. And thank you to the Zoota family for supporting these speaker series. And these meetings are really important because this is really the central point for the people in Tarrant County specifically to gather and get good information and to establish connections and to have a place to call home, so to speak, for the community. So thank you.
yeah. And then even DAPS.org, right? DAPS has got educational classes and they're continuing to expand.
And the thing is with DAPS is it's Dallas and that's not Fort Worth.
Right.
Right. But that's a real challenge with, like Parkinson Voice Project. I want to put in a plug for Parkinson Voice Project because not only are they fantastic from a speech therapy standpoint, which incidentally, upwards of 90+% of people with Parkinson's have some sort of speech involvement, but less than 10% of people actually seek treatment for it. So if anybody in this room, I highly encourage you to go to parkinsonvoiceproject.org. But one of the brilliant, and it's online speech therapy as well. There are groups and individual therapy, and there's daily speech exercises. But my husband has been a member of Parkinson Voice Project for probably 10 years now, coming 9 or 10 years. And we live in Fort Worth, but we have a set of drivers that drives him every week to the Intentional Singers group on Wednesdays. But I say all that to say, the magic of Parkinson Voice Project is not, in my opinion, the speech therapy is great, but the magic of Parkinson Voice Project is the community. And speaking to what you were talking about is, and I think a couple people mentioned here, being able to go somewhere where you don't have to explain why you're having a hard day, or you don't have to explain why your face looks the way it does, or why your speech is slow, or all of those things. There's no stigma there, and I think that that's one of the things that's hard to find, honestly. with living with Parkinson's is places where you can plug in, where you don't have to explain, or where you can just be yourself.
Yeah, that's great. Getting your exercise in today, Brad.
Get my steps.
Our group in Bedford meets at Brookdale the second Tuesday. They provide a free sandwich lunch. They kind of ask for reservations so they know how many to serve. But the second Tuesday of the month at Brookdale in Bedford.
Great. Thank you.
For caregivers have after lunch, they have a separate meeting.
Awesome. It's perfect.
Any other questions? Okay. Anybody on this side of the room before I go back to that side of the room? All right. All right. Here we go.
Thank you. My name is Dan Novak. I'm a person with Parkinson's, and there's a lot of good questions going on. I just want to say that a lot of these needs have been recognized, and they're not fully fixed yet, but trying to get information to the right people, trying to find out who to call and all that. I forgot to say a tribute to Murray to start with. If I start crying, you'll know it's because I have pseudo-bulbar effect, and I can't talk about people that are important to me without crying. But Parkinson.org is trying to address a lot of our questions out here, which are how does a new person get started? So there's now a page on there where you start on there. It says, here's if you're a new person with Parkinson's, here's how you get started. They also have a free 1-800 number that you can call and ask any question. Every question we've asked today can be asked to that 1-800 number. And there's people on there who can give you a hint and try to help you get started. Now, they're not local. And so we start with the local resources like Endeavor Parkinsology, the Parkinson's Voice Project, and all those folks. But if you have questions about Parkinson's in general, you don't know who to ask, you can look it up on the website. They've also announced a new AI version, which I haven't used yet, but it's called Pam. And you log on, you say, hey, Pam, help me with this question. And you can talk about webinars and seminars and fact sheets and all that. The question on training for people in the profession, there's a whole series now of training videos out there for people in the profession that want to educate their whole department at the nursing home or wherever it is. Those are available also. So Parkinson.org, and I'm just a volunteer. Been volunteering with them for quite some time, and I'm in the process of phasing out since I can't do all the stuff I used to try to do. Back to Brad's points, but I still find meaning in what little I can help. So thank you.
Thanks, Dan.
Yes.
I just want to add, it's World Parkinson's Day, right? Everyone's aware of that. And have you heard of the PD Avengers? That is a group you should all be a part of. Ray Dorsey was here recently, and he is a co-author of the Parkinson Plan. But their first book, Ending Parkinson's, was dedicated. Actually, that's not true. The Parkinson Plan was dedicated to the PD Avengers. This is a group of people with Parkinson's who are working to educate the world about Parkinson's and demand cures and treatment. So today is Spark the Night. Have y'all heard of that? Okay, a few of you have, yes. Spark the Night is once a year on World Parkinson's Day, and I want you to know the world is paying attention. If you look, for instance, in downtown Keller, they are lighting up the street blue, and the water tower is going to be blue in honor of Parkinson's awareness. And so look around in your communities and see if there's other blue buildings. Downtown Dallas, I know, is going to have a few. New Times Square in New York is going to be blue, and all in honor of Parkinson's Awareness Month. So check out PD Avengers. They are doing great things for awareness.
Anybody else? Surely somebody over there's got something. Okay.
One comment on the neurologist versus the MDS specialist. Um, the MDS have more training and a whole lot of things that they try to cover. So that's an amazing part of what they do. Neurologists have even more bucket, a larger bucket of symptoms that they need to cover. But we have found that, and I don't remember the statistics, but it's hard to look at. People who see a movement disorder specialist do much better than people who don't see a movement disorder specialist.
Yeah.
I'm not picking on anybody. They have way too much to do, but there have been serious mistakes in the past on people who are not current on on what's out there. And so I would encourage you to see a movement disorder specialist if you can. But then, as you heard earlier, there's a problem with availability. There's a problem with getting an appointment with Dr. Schumacher and other people out there. So that's the primary reason why people end up staying with a neurologist versus moving to movement disorder specialist. It's just the availability. But there's nothing wrong with starting with a neurologist, asking them good questions, asking them hard questions, and then going from there. As far as people to follow, I would say Dr. Oken is considered the primary researcher out there. Dr. Michael Oken, O-K-U-N, University of Florida. He's been a researcher and a specialist for years. He's treated some of the top people in the world were his patients. People like Muhammad Ali and all that were his patients. He's now graduated or semi-retired, and he now spends most of his day reviewing the research that's available out there and figuring out what matters to people like me. And so I follow him to read what he says every day. He's like, let me tell you 5 most important things from this study. And it's good stuff, right? And even Brad's been quoted on that, Dr. Oken. Dr. Bloom in Europe, Europe leads the way on the social aspects of trying to look at patients with Parkinson as a family. Dr. Oken is trying to initiate that real recently. He's published a framework that I think they're just starting on to say, how do we treat the patient as the center of the universe in this care model? What can we do to make a different care model available in the U.S.? It's hard. I've been telling these guys for years, you talk about patient being the center of the universe. It's not. It's not even close to happening in the United States like it needs to be. But with all of our help, it's going to be. Dr. Oken is trying to put a framework together. And the other problem is they just lost some major funding, or they're in the possibly lose some major funding at NIH. So that's something that we all need to be aware of. And there's a whole group of people that will help you with that availability. And last comment on the research is the Asian countries tend to lead the way on the technology aspects, like deep brain stimulation and stuff like that. They tend to graduate a lot of engineers who are interested in Parkinson's. And so they lead the way with that. Vas Bloem in Netherlands leads the way on the social aspects. And then the research in the U.S. is good. There are 10,000 people that attend that are members of the Movement Disorder Society that Brad just quoted. Their paper got published in their book. It's amazing when you go to these conferences and you think about the fact there's 10,000 researchers out there who care about the disease that you and I have and are working to get it fixed. Specifically in the U.S., there's a group called Parkinson, PSG, Parkinson Study Group. That's all the top academics in the U.S., including Brad and Indu and other people like that, that get together once a year. And it's really cool to walk in a room that's this big with every chair filled and know that every person sitting in that seat in there cares about us, cares about fixing my disease. And so there's something to be said for that. So their stuff is also available to read out there. So the research is all over the place now. That wasn't true 15 years ago. As Brad pointed out, the research on all of these non-movement symptoms was not out there, but now it is, or it's now in the process of becoming. So there's lots of groups that you can follow out there. And it's widely researched now that the people who go see a doctor tend to walk out of there with nothing in their hands when they're first diagnosed with Parkinson's. And so that needs to be fixed, and we're trying to fix that through Parkinson's Foundation, through through Davis Finney, and all the other people. Last advertisement, and I can't remember if this one's already happened or not. Dr. Oken does a once-a-year update with Finney's group.
Yeah.
And has that happened, or is that on my calendar? I think it's getting ready to happen.
I don't think it's happened yet.
He does a webinar where he reviews every major treatment and the processes, where it stands in the pipeline out there. And that's coming up or available now.
Yeah.
And that'll be on Davis Finney's website, which is?
I think it's davisfinney.org.
Okay. So lots of good resources out there. The problem with YouTube is there's some real scary stuff out there. It's so bad, so bad. I would really hesitate to do a blind search on YouTube anymore.
Thanks, Dan.
Okay. I won't run. I'll walk slowly.
For the next one? I mean, is there a mailing list that you have?
Yes, we do. Yes, we do. We do have a mailing list. If you're not on the mailing list yet, we'd like to have you on the mailing list. You can just catch up with me after this. I'll take your information. Or you can email me, brad.cannell, CANNELL, BRAD.CANNELL at tcu.edu. Yeah. Yes. If you got an email from me already about this event, then you're on the list. And if you registered online and you didn't have to put your name and email address in there, but if you did, then I will also see that. But if neither of those things happen, or even if they did, and you just want to email me, I already get 400 emails a day. I'd love to get 401. Yeah. We had two hands up over here. Yeah. There may be. Thanks for letting me know. Thank you. Yes.
Yeah, I just wanted to mention, I know you briefly mentioned Rocksteady Boxing, and some of you may be familiar with Rocksteady Boxing, but when I got diagnosed a couple of years ago, I immediately joined a Rocksteady Boxing group, and I'm so glad I did. It not only gave me a structure and a place to go to deal with my physical needs with Parkinson's, but something I didn't realize was it allowed me to develop some social relationships there as well with individuals that also have Parkinson's, that understand, and they've developed into some very close friends as well. So it's been a dual benefit for me. Then, of course, a lot of them as well, we share a common spiritual connection as believers. So we've developed into this, it's just helped me in so many ways. And then, of course, I also have, I attend Bible study fellowship, if any of you have heard of that, which helps me with my spiritual side as well. And I appreciate today the other aspects that I need to participate in as well. But I just wanted to mention Rocksteady Boxing, because it's really been a tremendous, tremendous help for me, and I look forward to it. Some people say, well, you can do some of those exercises and so forth in your home, but then you're alone and you're not connecting with others as well. So I want to encourage you with that.
Great. Thank you.
Thank you. Brad, it's 11:17. So how about we end the Q&A?
Yeah.
Okay. Can we all have a round of applause for Dr. McDaniels?
Thank you.
Thank you very much. All right. We're almost at our end of time. I just want to, first of all, thank you all so much for coming here today and being with us today. We've talked a lot about Chris. Dr. Watts has been brought up a lot, and there obviously won't be another Dr. Watts, and it certainly won't be me. Those are way bigger shoes than I could ever fill. But what I will tell you is his vision is still with us, and the center will not be the same as it would have been without him. There's no way we could do that. Again, there was only one Chris Watts, but it will survive, and it will be better for his vision, for his impact, and even for his loss. And it will be because of the help of the community here at TCU and in Fort Worth and Tarrant County and all of you sitting here in this room. And so we really appreciate you being here. We really appreciate your involvement. And we really do want to know what you need us to be, right? We've talked about meaning and purpose today. Our meaning and purpose at the TCU Center for Neurodegenerative Disease is you. You are our meaning. You are our purpose. And we need to know how we can be there for you, how we can help you. And we're getting some new, exciting young researchers in that have a lot of talent. We've got some old researchers back there that still have talent. So Dr. Adam King is here with us from the Center for Neurodegenerative Disease. He's one of the old ones. And then Leah Botkin is one of our new recruits, super talented, occupational therapist by training, so much passion, so much energy. If you haven't met her, meet her before you leave, okay? And then talk to me, email me, brad.cannell@tcu.edu. Help me help you, right? What can we do? How can we be better for you? Because that's what we really want to do. And again, another thanks to Dr. McDaniels. We really appreciate his time. We really appreciate his expertise. I'm going to speak for him, and I think he'll be okay with it. Shake his hand, ask him your questions, talk to him after this. He's going to get a free lunch. Make him earn it, okay? And then finally, if you want to team with us to make an impact on Parkinson's in Fort Worth and Tarrant County, you can do so in a lot of ways, but please consider donating to us as one of those ways. If you are interested in donating time, money, advocacy, effort, talent, you can contact me. Specifically, if you're interested in donating money, you can contact Mr. Jerry Cumpiano. He's our Director of Development for Harris College. Okay, thank you again to Dr. McDaniels, to the Zoota family. We really appreciate you all. Without you, this wouldn't be possible. And I look forward to connecting with everyone here in the near future. Have a great evening.